Welcome, everyone.
Yeah, welcome and good morning. And thank you today. Thank you to everyone today for joining this webinar on a caregiver's guide to Alzheimer's and dementia. Our guest today is Roy Capps. He's a caregiver education specialist from Sunnyside Community Services. So today's topic will be about understanding the basics of Alzheimer's and other forms of dementia, including the warning signs, stages, symptoms, and behaviors of the person for whom you are caring. Feel free to ask questions at the end, either by using the raise hand feature or by typing in your message in the chat box. Welcome, Roy, and thank you all so much for joining us today.
It's so good to be here today. Again, my name is Roy Capps. I work for Care NYC, which is part of Sunnyside Community Services. It's really great to talk to you today about this issue. And the title of this conversation is Caregiver's Guide to Alzheimer's and Other Forms of Dementia. And I always like to have that word caregiver in there because we will be talking a lot about what's going on with a person with Alzheimer's and dementia, but we're also going to make sure that we're including caregiver issues and ways caregivers can help themselves be better caregivers, because we really find that if we don't have, we really have to make sure that we have both people getting a lot of help, both the person with Alzheimer's and the caregiver. So let's get started. We're going to start by talking about Alzheimer's, as Cindy had mentioned, and talking about dementia. Let's first start with definitions and what the difference is between Alzheimer's and dementia, because there's been a lot of confusion about this. And when I do seminars and when I talk to people in libraries and senior centers, they often ask me these questions. So I'm going to be answering a lot of these questions that are brought to me. So Alzheimer's and dementia. First of all, let's talk about dementia. Dementia is a cognitive impairment. You'll hear a lot more lengthy definitions, but what you need to know is when you hear the word dementia, it really is about some problems in thinking, right? And there's a lot of different forms of dementia. Now, this word dementia, it's really quite a loaded word, because back in the day, we used to have a lot of talk about demented people, crazy people. And this has made the word dementia kind of seem outdated. And I believe that they're going to be revising some of the language surrounding Alzheimer's and dementia, and they're going to be changing that word dementia. So hopefully in the next few years, we're going to be getting a word that kind of suits what this is, which is just problems in thinking, cognitive impairment. Another thing that people don't understand about dementia is dementia is a large umbrella that kind of incorporates any disease, any condition where there is a cognitive impairment. So dementia is really a descriptive word. So when you think of dementia, recognize that there's over 200, some 300 types of dementia. And it's really important that as we talk about it, we understand that some of these dementias, 200 or 300 types of dementia, some of these dementias can be cured, right? We know a lot of the ones that we've talked about, that we're going to talk about, can't be cured, but some of them can be cured. So there's a lot of good reasons for, if let's say your loved one, a family member is having some memory loss, or you are having some memory loss, there's a lot of good reasons for you to go check that out. First of all, if you might find out that your type of dementia can be cured. I'm going to give you a simple example of a type of dementia that can be cured very easily. If I cut my finger, right? There's a cut on my finger, it gets infected. I don't go to the doctor, I don't have any treatments, and that infection goes into my body, and then eventually goes up into my brain. And that's when it starts getting really serious because it starts to impact the way I think. It's a cognitive impairment when I become delirious because of an infection. And so if your loved one has an infection that you're not aware of, and you start seeing memory loss issues, you may get concerned and fearful that it's the big Alzheimer's word or dementia word. And you may think, well, I'm sure it can't be that. Let me just wait, right? There's no reason to wait when you see a memory loss problem. The idea is to get to the doctor as soon as possible, because if I got to the doctor sooner, I'd be able to get that infection cleared up with a simple antibiotic usually, which means that that delirium that I was having because of the infection would disappear and I would be back to normal. So it's really important to recognize that when we talk about dementia, take that stigma out of it. Just think of it as problems and thinking, and that we really need to make sure that we get to the doctor. So the doctor can help us either by defining what the dementia is and curing it, or if it's something more serious like Alzheimer's or another type of dementia where there is no cure, you can start on a plan that actually can help the disease. It can help you minimize some of the symptoms. So what I'm talking about is usually medications. So there's several medications out that are not going to cure the disease, but they are going to help with some of the symptoms. And since we know that it's a chronic disease and it's a degenerative disease, which means it gets worse and worse and worse, any amount of help along that path that minimizes some of these symptoms, and we're going to review the symptoms a little bit later, can really improve the quality of life. So there's great number of reasons to get yourself checked out or get your loved ones to the doctor. Don't let the fear of Alzheimer's and dementia make you afraid of going to the doctors for a diagnosis. Okay, that's the first thing. So we've talked about dementia. So now we're going to go into Alzheimer's. Alzheimer's is somewhere between 50% of all cases of dementia, all cases of people with problems in thinking, turns out to be from Alzheimer's. And there's a lot of different types of dementia, as I mentioned. And some of them, each one of them has their own unique characteristics. And some of them have different symptoms. But we're going to review what goes on with somebody with Alzheimer's going forward, since there's so many more people that have Alzheimer's. But if you're concerned about another type of dementia, continue to listen, because very often the idea of Alzheimer's can very often be very closely associated with a lot of the other dementias. Okay, so now that we know that Alzheimer's is such a large portion of dementia, let's talk about some of the risk factors. Age is the #1 risk factor. If you're over 65 years old, you have about a 1 in 9 chance of getting Alzheimer's. If you're over 85 years old, that increases quite a bit to 1/3 of the population. So when we talk about 1/3 of the population over 85, that's when it's so important to make sure you get that diagnosis, because it may be if we can control the Alzheimer's on some level by controlling some of the symptoms, there's a chance that that quality of life can extend out to the natural lifespan of a person. Many people don't know that Alzheimer's can last about 20 years. That's quite a bit, but it's a little bit deceiving when I say that, because usually the first 10 or 15 years, there are no symptoms, right? So we have the first 10 or 15 years, no symptoms. People don't know that they have this issue going on in their brain that's slowly deteriorating their brain, right? So what happens is that last 5 years, is when the disease and the symptoms emerge. And we're going to be talking about the symptoms in just a moment. But that's why it's so important to get tested and make sure that you're taking care of yourself, because you want that quality of life to extend as far as possible in order to just have a better life in general. So let's talk a little bit more about some of the risk factors. We've talked about age. Family history certainly is part of the risk factors of getting Alzheimer's. But I want to be clear, we're going to be talking about this, but just because you have a risk factor because of a family member, it doesn't mean that you're going to get the disease, right? So keep that in mind as we talk about this. If you have a family member in your immediate family, a mother, father, sister, brother, that gets Alzheimer's, you're more likely to get the disease. If you have 2 people in your immediate family, you're even more likely to get the disease. So keep that in mind. African Americans are twice as likely, Hispanics 1.5 likely to get the disease than Caucasians, whites. And women have a 1 in 5 chance of getting the disease, as opposed to men, which have about a 1 in 11 chance of the disease. So a lot of statistics here, but keep in mind, whatever group you're in, these statistics don't mean that you're going to get the disease for sure. There are some family genes that could make you have a higher chance of getting the disease, but those genes happen to be very rare. So more than likely, if you're falling in one of these categories, it's really important to take good care of yourself so you can minimize some of the chances of getting the disease. We do a lot of programs at Care NYC about brain health. So one of the things that I would recommend is making sure you get 8 hours sleep. That can help you a lot in minimizing your chances of getting Alzheimer's or delaying the effects of Alzheimer's. Getting enough sleep, handling your stress, interacting with others, exercise, learning something new, and diet. All of these are lifestyle changes that you have control over. And if you want to learn more about that, of course, there's a lot more programs that we have. So let's talk about some of the symptoms of Alzheimer's. We're going to break it down into a few different categories because we really want you to understand what's going on with the symptoms. And with the symptoms, we're going to be talking about part of the behaviors and part of the solutions as well. So Alzheimer's is characterized, like we said, of problems in thinking. And the first one is what everybody knows about the disease, memory loss, right? You notice that family members or yourself are beginning to have problems with memory loss. But that's not the only thing that I want to say about that. You have to recognize that it's really the short-term memory that is having problems, not so much the long-term memory. So what does that mean? If I have Alzheimer's, I may not be able to tell you what I had for lunch, but I can tell you about that first car that I owned or my wedding. And I might be able to talk about what happened in my distant past when I was a child or early adult with great detail. So too often when people know that their loved ones are having some sort of memory problems, they get conflicted about going to the doctor because they think, but mom can tell me in great detail about things that happened in the past, and I can't believe how good her memory is. So recognize we're talking about short-term memory. We're talking about what happened yesterday, what happened last week. And if you don't recognize that, it could be confusing when you're looking at these symptoms. You may think, well, I think she's doing okay because she can remember what happened in her distant past. So short-term memory is definitely affected. Other problems in thinking are problem solving, performing tasks, that's sequential tasks, When I say sequential tasks, it sounds like I'm talking about some big project, right? Or something at work where there's a lot of complexity to it. But what we don't recognize too often is that when we get up in the morning and we get ready to work and we get to work, we probably completed about 40 to 50 steps to get us to that front door of our office building. So when I talk about problems and tasks and performing these tasks, what you might see is somebody with Alzheimer's going out of the house with shampoo in their hair. So these tasks have to be done in order for them to be successful. So just having one of those tasks, like washing your hair and then forgetting to rinse, could really be an indication that you might want to talk to that person and get that person to a doctor. So recognize that. So the first part we've talked about, problems in thinking, problems in memory. Remember those two things. The next one is very much a surprise to people when I talk about this. Mood and personality are definitely affected. Mood and personality. So what that means is that your mother or father, if they have this disease, they may begin to change. Their emotions may start to shift. Somebody that might be the matriarch of the family may become much more fearful and tearful than they ever have before. If you're seeing changes in personality or changes in the emotional life of somebody, you want to get them to a doctor to make sure that they're okay. When I talk about mood and personality, it's important to recognize that some of this is, you're going to see people perhaps being very happy in one moment, and one thing can trigger them to get them to be very angry or very sad or fearful. I'll give you a quick example. I worked in nursing homes for many, many years before, and I remember helping this one woman who was enjoying a group of activities we were doing together. And I told Miss Smith, I said, Miss Smith, I'm going to move your chair a little bit so you can be more comfortable. Well, when I moved the chair kind of jerked a little bit when I was moving it. And Miss Smith, who has always been the most polite, the most sensitive and kind person I've met in the institution I was working at, she begins to scream at me. And not only was she screaming at me, she started to curse at me. And I was shocked. I was shocked. I was new in working in a long-term care facility. And I thought to myself, what did I do? Wow, what happened? I don't understand. And I would always remember that day, because now that I'm working with caregivers, I think very often caregivers go through this each day. They don't understand why their loved ones are getting angry or fearful, or they start to cry. They don't understand what's going on. And very often they think, I must have done something wrong, right? So recognize you don't have to take these symptoms personally, but it does help to have an education about this disease, because these mood shifts and personality changes can really be surprising. Because some of what happens is their filter for saying curse words or racial slurs has been impaired, which means they think the first thing that comes to their mind. And so they may be acting in ways that are very surprising, but recognize that's part of the symptoms. It's not part of who they are. It's part of what Alzheimer's brings to the table. Recognize that they may have problems in speaking. In the early stages, they may be fine and they may be able to speak very well. But as the disease progresses, communication can become a problem. And you might find that using your hands and being more, giving more cues with your body and your facial expressions can be very helpful as a way to communicate with them. Because not only may they have trouble communicating, speaking, they may also have trouble processing a lot of information, which means that you might be able to slow down your speech a little bit and shorten your sentences. And as a result, you might get them to understand you better, and that might help your caregiving responsibilities. I know my mother, when she was alive, she was Colombian and she spoke very, very fast, very, very fast. She probably would have had a hard time talking to somebody with Alzheimer's because she talked a lot and she talked really fast. That's not a problem for somebody without Alzheimer's. But when you do have Alzheimer's, you can have a hard time processing too much information. So keep the choices simple, keep your language simple. That can really help them. And the last symptom, and this happens toward the later part of the disease, is physical decline. This is a rough disease. It starts off with a higher functioning thinking, and then eventually it starts to impair anything from incontinence to walking to talking to swallowing, and eventually maybe even to breathing. And that may be eventually part of what happens in the end. They may die from some sort of respiratory problems, maybe a pneumonia, something like that. Each case is a little different. But one thing that I want to say now, I've talked to you a lot about these symptoms. It's really important to recognize these symptoms because then you can talk to your doctor when you see new symptoms emerging or when you see certain things changing. Too often, caregivers don't know a lot, understandably, about the disease. And so when they go to the doctor, they might just say, I don't know, she's acting strange. I don't know what else to tell you, right? So now that you have more information about the symptoms, you may be able to give them more information when you go see a doctor about what is changing with them and what has improved, perhaps. So when I talk about all these symptoms, recognize that the disease is going to progress slowly at first, and that's going to be the earlier stages of Alzheimer's. And then you're going to get to a place where they'll become less independent. And that's going to be toward the moderate stage of Alzheimer's. And that's where they really need to have somebody with them to make sure that they keep safe and they're able to help them with their daily activities. And eventually, as the disease progresses, they may start to have a lot more physical problems, which means that the care that they receive is going to be pretty much 24 hours a day. So as you can see, as a family member who's caring for somebody with Alzheimer's, it's really important that, number one, they get tested for the person with Alzheimer's to make sure that you understand what's going on. And number two, recognize that as a caregiver, you are in need of help. And as a caregiver, you are having a higher risk. You are at risk for being overworked, having too much stress in your life, and becoming isolated. So recognize that when you have all these symptoms, because caregivers can have symptoms and conditions as well. That's why very often they talk about Alzheimer's as a family disease, because it affects the other people that are caring for that loved one with Alzheimer's, because it's a tremendously stressful and overwhelming responsibility to be able to care for someone. And too often caregivers are not getting the help that they need, and they're not asking for the help because they're not recognizing that they need that help. I can tell you for sure that that's happened with me. About 7 years ago, I was helping a friend. His father had Alzheimer's. At the time, I hadn't worked that much with caregivers. I knew a lot about Alzheimer's, so I told my friend I would help him out. So we looked for services for about 2 months, and we found a lot of good services that could help his father. But never once did I think, let me get some services for my friend, the caregiver, and his family, because they need those services as well. And that's why New York State has created these grants, and you'll see them throughout New York City. And these grants are for caregivers. They offer respite services, so caregivers can have somebody come into their home and help them. Temporary services that can be for free. If you qualify, they have a lot of other services like support group, education training, which is this. And all these services can really help caregivers manage the day-to-day complexities of caring for somebody with Alzheimer's. If caregivers don't get the help that they need, it's not uncommon for caregivers to become sick, to become physically sick because of the high amounts of stress, being overworked, and being isolated. When you have stress, when you are overworked and you don't have time to express yourself and you're isolated, that's a good recipe for depression. It doesn't always happen, but you're at risk for depression as well, and you're at risk for caregiver burnout. So I know there's a lot of information I'm covering now, but the reason why I'm telling you all this is because I want you to know that there's help. There's help that you can get, and that help comes in the form of solutions for caregivers. The first is making sure you get educated about the disease, and make sure you get educated about caregiver techniques. So one of the caregivers techniques I talked to you about earlier is slowing down your speech, making sure that your sentences are shorter, don't talk too much, let them process the information at their speed, be patient with them, try not to argue with them. It's hard work, but there are techniques and there are skills that you can learn. And I know for a fact that these skills can be very helpful. When I worked in the nursing home, somebody was nice enough to teach me these skills over a period of years. And because of that, because of what I learned, the people with Alzheimer's would come up to me and they would ask for my help because they recognized that I was listening to them, that I could talk to them, and that they felt like they were being treated as human beings, and they felt better after talking to me. This isn't because I have more charm than anyone. It's simply because I got the skills and the techniques. I became a better professional caregiver by learning these skills. You cannot treat somebody with Alzheimer's like you treat somebody that does not have Alzheimer's. There's a lot of finesse and complexity in being a good caregiver. And when you become an educated caregiver, you're actually going to find some reward because you're going to see that the quality of life of you and the person with Alzheimer's will probably increase. You'll probably have moments where you feel like, I'm really helping this person I love. I'm so glad I got educated about the disease. So, solutions for caregivers, make sure you get that education. There's a lot of great programs around New York City. If you see caregiver issues, behaviors, communication, these are all code words for getting those types of skills that you're going to need. Make sure that you also get support for yourself. You may feel like all you need is to get that help for your mother or father, but if you don't get that help for yourself, you may burn out. You may burn out from, like I said, the higher risks of a lot of stress in your life, becoming overwhelmed, because very often what can happen is as the needs of the person with Alzheimer's increase, so does their dependence on the caregiver. So as a result, the caregiver starts working harder and harder to get the needs of the person with Alzheimer's met. And because of that, it starts to become more of a 24-hour-a-day job. And that's when the stress hits. And that's when feeling overwhelmed hits. Very often they may feel like they're not making very much of an impact on their loved ones. Like I told you, some of the mood and personalities can be very hard on their loved ones. So keep that in mind. Peer support is really important. Getting into a support group, that can be very helpful. Sometimes your best friend can be a great person, but if they don't know about Alzheimer's and caregiving issues, they may not always be the right person to talk to. So keep that in mind. Also, the last one I would say is making sure that you stick close to your doctor. The reason why I say that is too often caregivers who are caring for people with Alzheimer's, they have to go to a lot of medical appointments because of their loved ones, right? And too often they start to neglect their own medical appointments, neglect their own checkups, their own medical checkups, because they need to take care of a person with Alzheimer's. So as a result, they become sick through neglecting their own health because of that higher levels of stress, because of isolation, because of becoming overwhelmed. And when that happens, they may not be able to care for their loved ones. And as a result, their loved ones may end up in an institution of some sort. So what we're trying to avoid is the caregivers becoming sick and not able to be caring for their loved ones. So we want to make sure that we're giving the caregivers enough attention. We want to make sure that we're giving the person with Alzheimer's better caregivers as well. So that's about it. I'd like to hear from you. If you have any questions, I'd be happy to answer any questions you have.
Thank you so much, Roy. And I just put in the Zoom webinar chat box, that folks can feel free to type in any questions they may have, or they could also unmute their audio to also chat as well. And Roy, a quick question regarding diagnosing Alzheimer's disease. I know you mentioned that a lot of the problem solving and performing sequential tasks and problems in thinking and memory is important in determining whether someone has maybe Alzheimer's beginning stages. And so how much of that activity do you need to ascertain that is enough, that is sufficient enough before you say, you know what?
Okay, yeah, I got it.
Get this person to a doctor. So I don't know whether it's a recurring incident or whether it's a one-off or maybe it's a combination. But I think in terms of the warning signs, I don't know like how much do we need to see before we take the next step? Right.
That's a great question. So when it comes to memory loss, I know every day, pretty much every day, I'd like to say this is not true, but every day I lose my keys. It's a temporary loss. I find the keys, it's no big deal. But that would not necessarily be a sign that I have any sort of problem, right? First, for two reasons. The first is that I have enough mental capabilities to find them, and I don't get upset that I lose the keys. I know within 2 minutes I'll be able to, find my misplaced keys. But if you see a pattern of people forgetting very important information, or they're forgetting things that are really impacting their independence, then that's something that you might want to check out. Also, each person is a little bit different, right? If you are seeing changes in that person's abilities and it becomes a pattern, that's really important. Some people, they can be a little forgetful and they've been able to live a healthy life, no problem. Other people have been very quick, with no issues. So you really have to look at that person's ability and to see if they're changing and to see if it becomes a pattern. The other thing I would say about memory loss is there's different types of ways of losing your memory or having memory issues. It's one thing to lose your keys, right? And be able to find those keys. That might be a problem that we all have. But if we find that we don't know how to use the keys in the door, or we think it's something for something else, when you see your loved one puzzling over how to use a key, recognize that that's a sign that none of us would have had unless there's some serious medical condition going on. So there's a lot of different things. As far as the other things, problems in thinking, problem solving, task performing, like I told you, like take a look at like task, sequential task. If you forget one ingredient when you're making a cake, that's something all of us could do. But if you forget to, and you leave your hair wet with shampoo in your hair, that's completely different. That's a completely different way of losing track of the sequences that you're going through. So keep that in mind. Usually you're going to be a little surprised. And recognize too, especially with memory loss and problems in thinking, too often that caregiver is usually right beside them, correcting their speech, helping them remember. And too often, caregivers, other family members start to step in to compensate for these problems. And because of that, we understand the reason why they do that is because they love their loved ones, right? But they may be delaying the process of getting a proper diagnosis. And I want you to understand what a proper diagnosis is. When we talk about a proper diagnosis, we're talking about going to a neurologist or going to one of these centers for excellence in Alzheimer's disease. There are centers all around New York City, and you can look them up, the Centers for Excellence in Alzheimer's Disease. The reason why I recommend them is because it's their job to diagnose people with Alzheimer's. If you go into one of their centers, I've been in a couple of their centers, you'll see them doing cognitive tests, psychological tests, memory tests, blood work, genealogy information, quite a series of tests. That's how you find out whether you have Alzheimer's or dementia. You don't find it out by saying, well, I think my neighbor told me that it looks like it's Alzheimer's, right? Alzheimer's is different than aging, right? You not just, everybody doesn't just get a memory loss and problems in thinking as they get older. You have to distinguish that. It's important to distinguish it because you really are losing out on some of the help of getting a proper diagnosis. Getting an early diagnosis will mean that you'll have a lot more resources at your fingertips, and you'll be able to help that person with Alzheimer's a lot more. That's a great question.
Oh,
Thanks.
thank you, Roy. And on that, when you say early diagnosis, so when you go to these specialized centers, do they do like a CT scan or MRI to specifically determine?
CT scan and like I said, all these other battery of tests. All of these tests, they can't just do one of the tests. They have to do a whole battery of tests to make sure that they're looking and they really understand that it's Alzheimer's. Because the only way to be 100% clear whether it's Alzheimer's very often is to do an autopsy, but that's not what we're going to do, right? But you can get a pretty good clear definition and diagnosis by going to these centers. And by going through this battery of tests, you'll be able to see whether your loved one or yourself is having those problems, those conditions.
Got it. So how would you bring that person to either to agree to either see a neurologist or a center of excellence in terms of persuasion, or they'll ask, well, why are you taking me to this place?
Right. Part of why I always begin this talk about talking about a lot of different ways that you could have problems with thinking is because that can be used really effectively by telling them it may not be Alzheimer's, it may not be something, it could be something that can be corrected. And that's not a lie, that's simply something that you can let them know as a way to get them to the doctor or get yourself to the doctor, because it's true. It's true that you cannot diagnose yourself with Alzheimer's, and worry and fear about the disease won't help either, right? So also, if you're seeing any sort of physical problems with them walking, you might just tell them, you know, we need to check that out, right? We need to check that out first. And by going to a neurologist or your primary doctor first, they can start to guide you better into ways of getting that person. Because too often people don't know very much about Alzheimer's. And when someone doesn't know about Alzheimer's, they tend to make their choices too simplistically. They may think, oh, you know, if I'm gonna die anyway, what's the point? Who cares if I can't remember, because, you know, I won't remember anything, so who cares, right? My mom died of this disease and I know what it's all about. I don't need to go to a doctor, right? There's a lot of reasons why people give for not going to see that doctor. But as we know about any type of disease or any type of condition, it's really important that they go there because they may get more help with some of the symptoms as opposed to a cure for the disease. Each year they come up with different medications and different ways of treating the person with Alzheimer's. And we've come a long way in the last 20 years in getting more help to the person with Alzheimer's and more help for their caregivers as well.
Got it. And Roy, one last question. So there is no cure per se. It's just about managing the symptoms.
Right. This is particularly true with Alzheimer's. Like I told you before, some types of dementia, there might be some treatments for. And also some types of, each type of dementia has its own characteristics. Some types of dementia might lean more heavy on physical functioning, damaging your physical functioning. Others might be mood and personality. So each dementia is important. That's another great reason to get to the doctor. But when it comes to Alzheimer's, at this point, there's no cure. But recognize that minimizing symptoms can be equally as effective on the short-term level in helping that person with Alzheimer's. And helping the symptoms, you're helping them have a better quality of life.
Got it. No, well said, Roy. And, you know, thank you so much for your time today. And I want everyone to know that please join us again next Wednesday, July 8th at 11 o'clock, because Roy will be also doing a presentation on a caregiver's guide to communication and behavioral issues. And Roy, would you like to give us a heads up on what to expect on next week's call?
Yeah, it's really going to be a continuation of what we're talking about now. And you're going to learn a lot more of what behavior issues and communication is all about. I will tell you one teaser to get you thinking this week, which is caregivers need to recognize that behaviors of the person with Alzheimer's and dementia very often are about communicating unmet need. All right, that's a mouthful of words there. But what I'm trying to say is that when you see somebody that's having a behavior problem, they might be getting angry or they might be trying to get out of the house and do something unsafe. It's very often, if you get all of their emotional and physical needs met, you might actually be able to minimize some of those risks. Too often people want to take a, almost like a policing type of attitude of, let's make sure that we enforce these rules. No, you cannot go outside, no, you can't stand up because you might fall over. And unfortunately, we've found that those rules really don't work very well because the person with Alzheimer's forgets that they've been told that. They also don't really appreciate having people treat them like children because they're adults with problems, right? So when we recognize that, my mom seems like she's really angry at me right now. Maybe I need to check to see if she needs to eat. Maybe I need to check to see if she needs to go to the bathroom. I've been seeing her rub her arm, maybe there's an injury there that she's not telling me about. People with Alzheimer's may not be able to tell you what's going on with them and what their needs are. So the caregivers that are able to be kind of like detectives and looking at that caregiver, finding out whether they might be too hot or too cold, whatever the case may be, you may find that you can reduce some of those symptoms, reduce some of those behaviors that might be problematic. Recognize that some of the behaviors are simply, if, for instance, if somebody is blind, you're not going to assume that they're not going to have problems walking around unless they've been trained, right? So the same thing with somebody with Alzheimer's. By telling them, don't you remember what I told you? That's not going to be helpful because they have a damage in their brain and they're not going to remember and they're not going to really understand what you're talking about. So we're going to be talking a lot more about this. We're going to get into details. We're going to roll up our sleeves and find solutions. What I found is when people join in for this behaviors and communications, they usually go with some really tangible skills that they've never heard of before. So welcome to come back next week. I look forward to doing the next presentation here at PSS. Thank you so much.
Thank you, Roy, and thank you to all the participants, and we look forward to seeing everyone back here next Wednesday, July 8th at 11 o'clock. Thank you, everyone, and have a great day. Thank you.
Take care. Bye now.